Hello, everyone. Welcome to the next episode of Problem Solved, Fixing Last Mile Engagement in Healthcare. I'm Shub. I'm the founder of Predict Health. And with me, I'm so excited to welcome Joe Schneier. Joe is somebody you've all probably met and seen, but definitely heard from and seen some of his work. Joe has been innovating in the healthcare, education, insurance, and technology spaces now for 20 plus years. Joe is the founder and CEO of Circle Engage, which is improving processes and outcomes in the sales, marketing, and communications areas for the Medicare, Medicaid, and the marketplace sectors. Joe is also founder of Better Age and Cinematic Health Education, two innovative companies in the elder tech space. So just a tremendous amount of experience really working with, engaging, and improving outcomes in the senior market. So welcome today.
Thanks for having me. Thanks for highlighting that I have chosen all of the difficult sectors to work in. Don't know what that says about me, but glad to be here.
Super. So actually, let's start with that. It's timely because healthcare is facing some real trust issues as we see the sensational news across the last few months. But really, this is an area that you've tackled head on and really on the front end of working with members and prospects in the sales and marketing side. So let's start with something I've heard you say about the trust issues in healthcare. So why don't you give us your perspective here?
You know, it's really interesting. Healthcare across the board has been experiencing trust issues. But in the health insurance sector, which is where I'm spending most of my time these days, so with payers, Aetna, Cigna, these types of organizations, they already were not trusted by members. One of the classic things when I'm out speaking is to ask a crowd of people, how many of you here really like your health insurer? And I sadly have yet to have somebody raise their hand and say, yes, I do. So there's already a trust issue with health insurers, but Forrester released a really excellent report recently, within the past couple of weeks, I think, that said that trust with health insurers is at all-time low. It's the lowest it's been in the last 3 years. And there's lots of reasons for that. I think some of that is that we're seeing the news highlight more than before the challenges that consumers are facing. We're seeing more and more lawsuits brought both by this administration, the last administration, and more seriousness taken about tackling some of the issues that consumers are facing. The issue with that is it is highlighting for consumers that there is this gulf between their expectation of delivery of service and then what they actually experience. So yeah, I mean, those are just a few of the things that I've noticed.
And you see that repeatedly as members and prospects. Individuals have easier opportunities and many more opportunities to share their opinion, feedback, and voice. You hear more of it. So this is really an area where companies have to address. This is not something you could take, push it in the background, sweep it under the rug. Plans have to address this.
Sorry, just on that, I think that plans for a long time, like things are the way they are for reasons. It's not happenstance that we find ourselves in a place where there's this lack of trust.
Right.
And I think it was okay for plans in the sense of financially, it was okay for them to not invest in trust with their members. That has become less of a reality for the plans. If they're not investing in trust, they're losing members. Members are shopping more. They're losing out on bonus payments. It's just like a catastrophic effects that didn't used to exist. So there needs to be new strategies to meet this moment where you have overarching erosion of trust in healthcare and then specifically erosion in the health insurance sector.
You're absolutely right. And the numbers speak for themselves. If you look at Medicare Advantage and some of the special needs markets, turnover or churn, member churn, people are walking with their feet about 1 in 5 every year. And that's just voluntary disenrollment. And how do you build and how do you support long-term care, value for a member, and improve healthcare if 1 in 5 are going to walk out of your door within a year?
Right. And I know there's been some proposals by people I really respect, like Sash and Jane, to have a member have like a 2-year plan rather than a 1-year plan,
Right.
which I actually support and think is a good idea. But I also think to some degree it is putting a band-aid on the problem. Um,
Right.
People, we know this from other industries. If people like the service they're receiving, they tend not to churn. They tend to stay your customer. And I think there's a lot of reasons for the erosion of trust, but some of the basic things of like the expectation that a member has about what service they should be getting um, is, even if they are getting that service, they don't understand that they're getting it. The communication between a plan and a member is so broken down
Right.
that even when a plan is doing everything they can for them, they're not getting the credit for it. So I think there's just a lot of room for improvement, and not to look at these numbers and say like this is impossible, but there is possibility for improving those relationships.
Yep. And I think it starts at the beginning because so we would do a lot of work. Predict Health does a lot of work in the retention space, and you can AI technology data can actually help you uncover what are the challenges during that experience, and fix them and improve your retention. But the real way to solve it and the best way to solve it is like a marriage. You find the right fit in the beginning. If you have the
Right.
right match in the beginning, that helps the entire relationship. It's going to be a better experience for everybody involved. People are going to be sharing and leaning in, and that's really the key right
Yeah.
at the beginning. And it makes sense, but it's hard to do.
Absolutely, and I think it's really overlooked. So my last companies were focused more on like post-enrollment, selling to
Hmm.
providers, patient engagement. And this company, we as like you are focused on the side of healthcare that people don't think about, the sales, marketing, and communication side of healthcare. I don't think people even realize that there are uh, these companies have these branches within their organizations. But sale and lead generation is your first touch point as a brand with your member. And if their first experiences are confusion, feeling like they're getting spammed, getting too much information, uh, mismatch of what the information they're getting and what ends up happening once they get the plan, you're just starting off on the wrong foot. And then you're having to build trust that you've already lost. Which is so it's been really interesting the last 6 years to focus on this space. I've learned a lot about this side of healthcare that I think that we don't talk about enough, about how people find a doctor, how people find a health plan, and how we can improve that process.
You're absolutely right. Something that I've heard you say that healthcare has a $5 billion broken leads problem. So
Yeah.
talk a little bit about that. So how does that play out?
You know, essentially what's happening right now, what we're seeing. So we work with brokers and we also work with health insurers.
Right.
And we recently got in to the side of the market, which is called lead generation. So we've been spending a lot of time in that sector. And what we've found is a lot of the companies that work in lead generation don't come from like a deep healthcare background. They're in this business to find as many people as possible, um, get them qualified as some type of a lead, and sell and resell that person as many times as possible to as many brokers as possible. So you have consumers getting bombarded during AEP, during open enrollment in the fall with like a million messages, phone calls, and texts. Like you put your number into one of these websites and you'll, I unfortunately did this once and it was really a bad idea. And you just get inundated. And then what ends up happening for the brokers is that they're buying these leads that have been resold multiple times with people who are already annoyed. So now you as a broker are wasting your time, you're wasting the consumer's time, and it's just like a kind of vicious cycle. So, and this is from the crackdown on Joe Namath ads.
Right.
So we're seeing that there. We're seeing a whole bunch of different lawsuits being brought about. in the ACA market around marketing, there's been a significant focus on trying to improve it in the ACA market, and I anticipate in the MA space there's going to be a renewed focus on it as well. So it's just breakdown after breakdown, all of which I think is unnecessary. I think there must be a better way to go about this.
And the point you're raising actually is rings true and personal for me. I started Predict Health because of watching my father's experience engaging with healthcare. And actually, it was a purchase of Medicare Advantage plan, and it was a tremendously broken process. He was viewed as exactly as you said, it was a lead. It was a name and probably a potential dollar figure associated with it. And it was an aggressive sale from a broker or an agent. And they didn't know much about him. All they wanted to do was close the deal. And that led to high inefficiency because it's repeated 30 plus million times a year. That's just in Medicare and millions of times across all the markets. And if they know a little bit more about him, which is information that's available, how he buys, his constraints, whether he has a car or not, whether he drives, all that matters, and how not only could you get them to the right plan, but also how they can engage and access care, because it really sets up a different conversation and a relationship altogether. So that got me into Predict Health. That's how we started Predict Health, because this information that's available. But the point you're talking about is as leads being sold and resold is a real problem. How are you guys tackling it? Because you probably face this all the time.
Yeah, so we launched something new this last fall, and it's just a completely different way of thinking about it. So what we are doing is we are acting as like a qualifying process in between how top of the funnel leads get pulled into that funnel and before it gets to a broker. And what that means is when people reach us, our interface, we're helping them to figure out what is it that they're actually looking for. Do they actually want to talk to a broker, or is there a problem that they can't log into their health insurance portal, or they're trying to find a provider, or they saw an ad but they didn't mean to click on it and they don't really want to talk to a broker. So, and then in that we've developed a process to be able to determine also some things like automatically, like, is a person eligible for Medicaid? So are they an individual who's a senior and possibly low income as well? So that when they get to the broker, we're passing over information like the information that Predict Health has, as well as information around their what they're potentially eligible for, if they're eligible for LIS. Right. So then, and what we bring to the broker is we book an appointment with them. So this solves the broker's problem. The broker's not calling 100 people and having 99 of them be frustrated with them. They're getting maybe only 5 booked appointments, but those booked appointments are people who are raising their hand saying, I absolutely want to talk to you. And our hope for this is to solve one of like the real challenges in the industry of plan choice, which determines so much of people's financial stability, their healthcare access, just got ripple effects on their lives if they make the wrong choice.
Right. And it's a hard problem to solve. If you put yourself in a prospect or a member's position, they're facing 45, 50 different options every year in their market. That's the average number. It's probably going to adjust here and there, but that's more flavors than ketchup. It's really hard to make a choice. And they sound the same. They look the same. What do you choose?
Yeah, and the products have become more complex in ways that's really not. Like, we can think about complexity and think, oh, that's bad. But what it means is that the plans have become more personalized. Like, you can find a plan that is a really great fit for you as an individual. It covers your chronic conditions in a better way. It gives you better access to the medications that you have, or better access to the doctors you want to see. But how possibly can a consumer do that on their own? It is not possible unless they spend just an inordinate amount of time trying to sort through it.
And they're not experts in it. They won't be in this across the market, and it's really hard, and it's onerous to expect them to do it.
Yeah.
despite all the education in the world. So you do need brokers, you do need experts. So this pilot that you are talking about seems like it addressed two things. One was the trust issue, as well as understanding more context around intention and about the member itself. So
Right.
how did that play out for you, and how do you see that playing a role in the market?
Well, one additional thing that we're adding to this that I think really helps the plans and consumers as well is tracking through the process. Once a person talks to a broker, what happens? Do
Right.
they actually get a plan? Do they stick with that plan? And and our aim with that is also to look at how do we provide more quality benchmarks around brokers? Because one of the things that's confusing for our consumers is also like, how do I know this broker is selling me the plan that's the best fit for me, or is just selling a plan because, you know, their agency is pushing them to sell those plans? So really solving from that very first touch point of communication and awareness all the way through conversion, and then looking year over year to track that the brokers themselves, if they want to participate with us, are doing a good job on behalf of their members. So we're pretty excited. And we're seeing a lot of demand on the broker side. I think they really get the value proposition, and we're looking to partner with more organizations that are trusted resources, community-based organizations, faith-based organizations, to work with us to identify individuals who are on that search for either first time turning 65, getting a Medicare plan, or
Right.
maybe doing AP or shopping around.
Right. No, that's huge, and I think this is really exciting because it's shining a light and bringing some insight into a rather opaque market right now. The brokerage selection, plan selection is hard enough. Then how do you really engage with the brokers? Because that's and who should you engage with? I think it's there's a lot of value here. So very excited, very exciting time. Um, it's also leads to a question that you talked about, and I think it's a challenge for the industry is. You could be qualifying, say at age 65, you qualify for Medicare, but then if you meet certain income thresholds or you have certain needs or requirements, you have to qualify for alternative or supplemental types of plans. So there's another level of for lack of a better term, certification. And so now you have to go through multiple steps all the time to get care or get access to certain types of plans. That's a challenge. And I think it'll get worse in this administration, given some of the bills getting discussed. How are you tackling that? Because that's a challenge for both members as well as organizations.
Yeah, we're especially focused on individuals who are lower income or low mid income,
All right.
who currently qualify for either ACA with subsidies. They're older adults who qualify for Medicare and Medicaid. Those are the areas where we anticipate that if this bill goes through, which we think likely will, that there's going to be the most disruption for members. And this is on top of a lot of changing landscape under the last administration, with changing rules around eligibility, the types of plans offered. And so there's already shifting landscape, and this is just coming on top of that. So we operate with the basic premise that things have got to be easy. Like, brokers are human beings trying to run a business, and if you make it really difficult for them to figure out if a provider is in network, if a person's eligible for Medicaid, are they likely going to take that extra step? Maybe not, and I'm not sure if I really blame them. It's complicated for them as well. So we've introduced some new tools for them that allow them to, in an automated way, to identify who is eligible for these programs, for these supplemental programs, for Medicaid or for subsidies. It's a matter of just getting opt-in from the member, and I took a lot of work to build this out. It sounds like simple, but it was actually really, really challenging. But our hope in that is that it will help no matter what the shifting sands are, that they'll be empowered to actually solve the problem.
Yeah, and it shows up in the data. So we, as I mentioned, we track and look at and help plans with retention. And one of the drivers of retention or renewal for a member, a successful renewal, is continued eligibility to some of these subsidies or some of the programs. A lower income subsidy, which helps with drug plans or drug costs, is unfortunately off cycle because at state level it's off cycle to the plan year, and so you may lose eligibility during the plan year for many members. And if it's not renewed in time, the next time you go to fill your drugs, it's higher cost and it's a surprise, and it can be a real challenge for the member. So how
Right,
do you and it drives churn, and this is a
right.
problem that is a solvable problem with technology, with just a bit of foresight and the right attention to it. And I think this is a great solution, and I think it's going to have a huge impact.
I think it's technology combined with reminding ourselves of the value of a field broker, of a person who's not a call center rep who's paid by the hour, but somebody whose business is reliant on them maintaining a good relationship with
Right.
their customer base. And I think the industry could lean on them even more to be reaching out mid-year about things like LIS, or whether or not an individual is using their supplemental benefits. They are a communication channel that I think gets overlooked sometimes.
It is a powerful channel because you've bought something through them and you view them, regardless of whether the plan likes it or not, you view them as a representative.
Right.
And so you have to take it. You work with a large number of plans. What are some of the more innovative organizations doing in this area?
I'm seeing a lot of innovation on the post-enrollment engagement. Like there are some really good companies out there that I've seen or that are doing different things. I mean, Duos is one of them. A good friend of mine, Jen Kerfoot, works there and is, I think they've got really interesting model. I'm on the board of a company with a woman named Esther Dyson called Avonlea Care. And Avonlea Care is providing plans with the ability to communicate with a member through their caregiver. So like that type of engagement solution where you're again leveraging a trusted partner is, I think, it's innovative. It seems like obvious that it should have been done, but a lot of these things weren't done in the past. On the sales and marketing side, the place where we are seeing innovation are more organizations that are looking at the data. Um, Organizations like Predict Health, we're seeing less innovation and dollars being invested in companies that are looking at the process and creating really outstanding workflow um, uh, applications. I think it's been a neglected area of the market. It's not that there aren't some good players out there, but it's not received enough attention, and we almost want more more people to be coming in and trying to build and innovate in this sector. So
Uh, Great. And that's what we've also seen in addition to uh, we see the interest. Plans are looking for solutions. They are looking to understand how could you leverage some of these trusted relationships that are existing. You don't have to build a new one, but there's a lot more innovation around how do you work with providers, how do you work with care teams, people that are involved with the day-to-day of the member.
right, exactly. Yeah.
Um, how is so? Let's switch gears here a little bit and talk about another area around when you talk about trust. How are companies measuring trust? Because this is such an issue everywhere. There's concerted efforts around teams. It shows and trust shows up in not just in buying a plan. It's really also in the quality of a plan. How do you engage across the different pieces? Do you see some tangible steps plans are taking to really build this trust effort?
I think that that plans are trying to address the trust effort and to align that with their engagement strategies. And there's limited budget, and so it's much easier to try to align what you're trying to accomplish as a company. So engagement equals in plan world, member is doing things that we need them to do for our business to operate in the right way, in a way that is profitable for us, knowing that we operate at very thin margins, right? So and I think that that pathway has worked. Um, I have a real challenge back to the plans where I think that is not necessarily going to be the pathway that is going to continue to work. And there are just some very basic things that we're recommending that plans start to take a look at. And one of them is like just the language you're using on your websites. We've somehow made a decision that we all have to use healthcare jargon to describe things, like even things as simple as like the assumption that we have to use the words copay and deductible when we're putting information in front of consumers. But I was doing a bunch of reading the last couple of weeks, and the average American reads at a sixth grade level. And so I got a bunch of like 11-year-olds, which are people in sixth grade, to try to read health plans websites and to tell me what they meant. And I did not find an 11-year-old that could accomplish that. Um, and we reworded things in language that they understood, and they immediately got it. It's like the concepts are not beyond the average person to understand. And I think erosion in trust happens in those types of things too, when it feels like this antagonistic relationship, like you're intentionally trying to confuse me by putting this healthcare language that I don't understand, instead of meeting me where I'm at in the language I understand. And so some things like that, I think, could really benefit health plans in the sector to take a look at, and hopefully to, you know, augment what they're already doing on the engagement side. I'm not saying that they can neglect looking at their engagement strategy, because that would be, you know, foolish, but how do we align that with what the
Right.
consumer is also looking for?
That's right. Really understanding the individual and building around that. That's
Right.
great. There is a lot of, you're talking about the different things that they could do. A lot of plans, and we see this repeatedly, is they're currently facing a fair amount of attention, scrutiny, and especially with the new administration, regulatory change. So this is an area that is, especially on your side of the world, in the sales, marketing, and communication side, CMS, which is the regulatory agency, is spending a lot of time there. What are some of the regulatory changes you're seeing play out in terms of importance, and how do you see companies maneuvering and working to address them?
I think some of the biggest regulatory changes that are happening are around eligibility, um, especially things that are eligibility related to Medicaid,
Hmm.
eligibility related to like states that adopted Medicaid expansion and states that didn't, and how often an individual needs to reconfirm that they're eligible for Medicaid. Some of this, like I said, some of these changes were already like starting to happen under the last administration. We're already starting to see a lot of changes around open enrollment periods and all of that kind of thing. And so like my opinion on this is the expectation should be that there's going to be shifting landscape around the times when people are eligible for certain types of plans, how fast they need to respond, the data and how clear it needs to be, from very simple things like we know that most of the plans that we work with have a hard time knowing the correct address for their dual eligible members, like, and correct phone number, right? It's not a simple thing. These are more transient populations, but that's going to start to come into play if this bill goes through. They're going to need to be able to confirm on a monthly basis where people actually live, and these are major infrastructure investments that we're going to need to make. But
Right.
I mean, there's upside to that. Like, I think it's a good thing if we know where
Right.
people live, right?
Right.
So if we can come up with systems to improve on that, I think it's worthwhile. It's easy to look at all of these things and think like it's all just an attack on us. Some of the things I think will end up leading to improvements some not, but you know, whatever. You can't win them
At,
all.
at minimum, it's just the address piece. If you are able to re-engage the member, the continuity of care can be confirmed and maintained. People miss
Right.
doctor appointments, and people miss um, uh, refilling their drug prescriptions. That can be a big challenge if you lose your coverage,
Yeah.
and this is going to be important for that. How do you see plans getting ahead of this, because you're waiting for the bill? There's lots of other changes coming in place. How are plans addressing it? Because open enrollment is coming up very quickly, and on the sales, communication, marketing side, how could they be ready for this?
I think one of the ways, just concretely, that we see that there's a gap where they could be better positioned would be providing easier to understand educational material for their brokers. There's a lot of the brokers themselves are confused about what's in effect, what's going to affect which things there's an injunction that they don't need to think about, and which things actually went through. So just making it the very basics clear. I spoke at a conference recently on DSNP plans, and it was mostly a broker audience, and there was just a lot of confusion about the basics of what DSNP plans are. There's also a lot of growth in the CSNP sector that we're seeing.
Right.
I think it was like some over 60% growth last year, and that's also a type of plan that people, and those are plans, for people that don't know, for people with chronic illnesses and who are on Medicare. And so better information around those, who's eligible, and how does an enrollment actually work with that, just very, very practical. That'd be an area where I feel like we still have enough time to invest in it. I think also looking at this, how do we put in place some tools to help us with Medicaid like redeterminations, that are bound, like we can't keep our eyes closed. Stuff is going to shift in the Medicaid market. So what can we do to get ahead of that? And so we're not just really letting down our members.
Yep. Absolutely, and there's we're in the beginning of June right now, and we have a few months, and it behooves every plan to educate their front line. If brokers are in your mix, and it's a pretty prominent part of your mix of engaging members and prospects, if they don't
Yeah.
know, they won't be able to help you.
I guess the one other thing I would say is there's an RFI out from CMS, asking for suggestions, comments around improvements in technology in the Medicare space. And plans know a lot of the breakdowns in technology. And it would be, I think, easy to overlook this moment where you have the government saying, like, tell us what needs to be improved. And I'm really trying to encourage as many people as possible to respond to that, with any of the ideas they have of different places where they could see improvements.
That's great. I think CMS reaches out. This is the area to make your voice heard across the plans. What would be the one thing that you'd want to see there? What would be like come through on the technology?
Okay. They're both related to APIs from CMS. I have lots of things that I want to see
Yes,
changed, but okay, well,
that's why I
I'm
said
limiting to
one.
this. There's just, there are two APIs that we want to see radically improved. One of them is Blue Button. Blue Button allows a company to get access to claims data on a Medicare beneficiary. It's a wealth of knowledge on an individual, where a company like ours could really help to guide an individual in their plan choice, in post enrollment activity. Um, it's incredibly cumbersome to sign up for it, for a member to opt into it. So it's been very underutilized. So changing the user experience doesn't, it's not a big ask. And the other is an API called BQ that's also underused, and there's some real challenges in the way that companies can access that API. That one helps to determine eligibility for Medicaid, and Medicare. So, um, please
This is
These
tremendous
changes.
because they have an intent to help, and these are the ways you help. If if
Yeah,
they're clunky and it's difficult, it won't be adopted.
yeah,
So this is
yeah.
great.
And I have a
So
whole list of other ones, but we'll
yes,
leave it there.
this is great. So with that, we're wanted to start thinking of as you think about the next few months and running up to the end of the year. What would be your one guidance or one piece of advice for plans looking to sell into this market today on the sales side? So one
I
takeaway.
think you really want to differentiate yourself. Start speaking honestly and directly to members in language they understand. Even if you have to send a booklet that is all the detailed stuff, have an explainer document that you send out that is just very, very clear. It's one of the easiest things I think we can do to build trust, and make the lives of our members easier.
That's great feedback, and that should be the headline. It's really build the trust, and it starts with your first communication. It's
Yeah,
great.
yeah.
Um, that's super. Thank you so much for your time today, Joe. This has been a very exciting conversation and very far-reaching. I think this, even if some of this is adopted by CMS, I think it's going to have a huge impact on the industry.
I hope so. Yeah. Thanks for having me.
Yeah, great. Thank you very much. All right. Have a good one. We'll be in touch.
You too.